2.5 centimeter lesion in the distal sigmoid, removed by hot snare, piecemeal, and the bases and the edges of the lesion were treated with electrocautery. The pathology showed a tubular adenoma with focal high-grade dysplasia. In July of 2023, she had a follow-up flex sig that showed a residual lesion that was measured as 16 millimeters, and she is now at our Center for Resection.
Thanks, John, and welcome back. We're going to put the GI Genius on standby, but you can see it lighting up this polyp. So, as we always do, we've been up to the cecum and come back. We found only one small other polyp in the sigmoid, but in general, these large lesions have a high risk of synchronous disease. So even if the patient's referred for a distal lesion, we want to clear the proximal colon. So this lesion, the referring doctor described it in the distal sigmoid, but I'm measuring it at only 8 centimeters. It's actually in the rectum. And I say that because there is, in the algorithm of deciding methods to remove lesions, more of a rationale for en bloc resection in rectal lesions, because the rectum is by itself a risk factor for cancer. So, however, I'm not going to do that. I'm going to take it out piecemeal, but it is heavily scarred down. Now, there's a couple things about this that I would say. First of all, looking at it in narrowband imaging, I think the nice classification is 2 everywhere. You can see that there are multiple nodules of discrete tissue. There's one over there to the left that actually looks like a hyperplastic polyp, may just be a hyperplastic polyp kind of pulled into the scar. You can see scar on the cecal side of the lesion right here. I think the only part of the lesion that's not scarred down is the little nodule that's off to the right. But when I go underwater, you can tell that there's scar that extends all the way to the anal side of the lesion. So a lot of people, when they say they're using water, they're actually using saline. And John, let's start to close. We're right up against it. I'd rather actually get a nice piece. So we're underwater. I'm going to just use forced coagulation current here. Underwater, I think, made the difference, because even the fibrotic part over here floated up a little bit.